Welcome to the JEMS Report, brought to you by Clarion Events, Fire and Rescue, and the Journal of Emergency Medical Services. My name is Ted Lee, and I'm the editor-in-chief of JEMS Magazine. Along with Jeff Frankel, our managing editor, we are bringing you industry experts and leaders to talk about all things pre-hospital medicine. Today, we have a very special guest, Dr. John vonRosenberg, flight paramedic and educator coming from the East Coast of North Carolina. Thank you for joining me today.
Yeah, thanks for having me.
So why don't we start out with a little bit of your background for the audience, just to gauge, where you're coming from and what you've done so far.
So my name is John vonRosenberg. I am currently a full-time employee of a hospital-based critical care service that does air and ground transport, so ground by ambulance and air by helicopter. I've been in the flight and critical care world for the past 15 years. Before I did that, I worked county-based 911. I worked some hospital-based critical care, and a long time ago, I worked in the fire service. That's where I got my start. So fire, ocean rescue, EMS, and then critical care.
Today's focus is that flight background, and you have an extensive one for that. So why don't you tell us a little bit about how you got into flight and why you chose flight and continue to flight. Some people come into it and, this is something that they're very passionate about, but sometimes they flame out and they don't stay. Others have stayed and made it quite the career like you have.
Yeah, flight was always like a dream for me, but I always thought that it was an unrealistic dream, so I kind of kept it at arm's length. When I was working EMS, I was intrigued with the cognitive side of things, how things worked, how the body worked, and then through that interest, wanting to expand my scope out as much as possible. And at the time, ground EMS protocols were much more limited than flight program protocols. And so I wanted to do this thing, but I never thought that I was ready. I taught with someone who invited me to apply for a spot one day, and I did, and then I was selected. That was about 15 years ago, and it was an eye-opening experience to go from what at the time was a very progressive, very strong ground county-based 911 service to a flight program. The approach to medicine was different. The acceptance that every single call was going to be a challenging, critical call was a change from my 911 experience. And over the years, it has continued to change. Over the years, we've had a lot more helicopters added in the United States. And with that, we have some inevitable decrease in acuity of patients. So now even helicopters are flying the occasional patient that probably could be handled by some other means of transport. And the rationale behind utilizing a helicopter varies from region to region and place to place and sort of protocol to protocol. But inevitably, you have one sneak in, one patient that doesn't seem acutely ill, but that the rest of them, the majority of the patients who are challenging in a lot of different ways, whether it's medical or trauma, is what has kept me in it. I have interest in education and I love teaching as well, but what's kept me at the bedside is that scope of practice that I found in flight and the acuity level of the patient that I found in flight.
One of the things that you mentioned, early on in your career, the difference between flight and ground were, protocols, scope of practice, things like that. Have you seen that start to level out? Because, the big talk, of course, used to be that, flight was the only place that you could have blood products on it. And now blood programs are blossoming across the United States.
Yeah, I think that's 100% true. There are ground programs who are, RSI is widespread across the United States. There are a lot of ground programs that are performing RSI, blood, as you mentioned. And then there's even some places that are doing more invasive things like finger thoracostomies. Not some are doing chest tubes, but those are still kind of in hospital and flight program. But finger thoracostomies in the field. And then you have the tech side of things. So ultrasound is coming onto ambulances, and iStats are coming onto ambulances. And there's some flight programs that don't have that. So there's a whole lot of variety in ground and flight. And there are some ground programs that are absolutely phenomenal and have a very wide scope of practice that I didn't have when I was primarily ground 15 years ago. And then there are some flight programs who have a relatively narrow scope of practice. So it's possible that you may live in an area where the ground program actually has a wider scope than the flight program that serves that area. It all depends on medical direction and the leadership of the program and how sort of aggressive they are in pursuing these more advanced practices.
So for those who might not understand, and you say that there's a significant growth in the flight industry, and there are more programs out there. Why flight versus ground? For those who don't quite understand it, because we don't really go into a lot of this background from the educational standpoint. So new paramedics would look at it and they get starry-eyed and they think this is why, but not necessarily understand why this goes on.
Yeah, I mean, it's obviously the flight suit, right? So
Right.
The reason that I got into flight was the scope. As we just talked about, the scope varies depending on where you are. I think that as a whole, the scope of practice in flight is wider than the scope of practice for non-flight services. And just for the sake of the discussion today, when I reference non-flight, I'll talk about like county-based or however a particular area gets their 911 services. That's what I mean by non-flight. And then flight would be either hospital-based or community-based. That's a little getting in the weeds. But when you compare those two, the critical care flight service to the county-based 911 service, generally the scope is larger, is wider, is more expansive on the flight side. And so that's what I have found. Most people are attracted to flight for that reason. That's why I was initially attracted. And then you see that there's a lot of things that are even cooler than you thought they were. Flying around in a helicopter is very cool. The view that you get from your work is a unique perspective that I try to appreciate regularly. But then there's the scope, there's the challenge, there's the interaction with hospital and out of hospital personnel. It is constantly challenging, and that's the part that I like about it. So even if the scopes seem to be kind of leveling out from ground and flight, and again, I think that flight still has a relatively more expansive scope than ground, generally speaking. There are all these other challenges, the constant high acuity patients, the learning new things from ventilator management to blood product administration to pharmacology. That is what keeps me interested, and I think that's what keeps a lot of people interested and sort of drives them to want this as a profession. I think it may be likened to EMS and what lures people into EMS initially. They think it's the lights and sirens, and then the people who stay are the ones who are interested in the medical side of things, like how the body works and how we as a people can serve our communities in that unique out-of-hospital setting. And when you compare that to flight, what initially draws them into flight is this like high speed, low drag, flight suits and helmets and getting in the weeds with the sickest of the sick. And then what keeps them there is this sort of ongoing challenge and realizing that all of those different avenues, the cardiology, the pharmacology, the lung patho, like everything that people in the hospital do, we have to stay up to date on that to the best of our ability. And that challenge is what keeps people here, I think.
Yeah. Well, in reference to that, and you mentioned quite a few items there. How does somebody get prepared to go into this? Because if it's not the standard program, and we know that it's not the standard program necessarily, and if you're getting into something that you don't routinely see on your private or your county 911 systems, how does somebody prepare for this?
Yeah. The unfortunate reality is there's a lot of variety. And so I have some general steps that I'll propose, and then underlying all that, I want people to know that there's a whole lot of variety. So I think the first thing that you can do is be good at your job. I think that is an intensely important step. I've talked to people and heard of people who seem so obsessed with their next step that they forget to do what they are doing now well. And that is incredibly important because similar to the EMS industry, the flight industry is a very small group of people. And everybody talks to everyone else. And so your reputation will follow you wherever you go. So the best possible thing that you can do is do your job well. Expect a certain level of excellence from yourself, and then hold that level of excellence, sort of independent of what may or may not be around you. So make sure that you're doing the job well. The next thing in terms of preparing for flight that I would say is look for the opportunity to grow from an education standpoint beyond the restrictions of your current guidelines, beyond your current protocols. It is tempting to just be really good where you are and not realize that the world exists outside of your boundaries, whatever service that is. And I think this is where conferences can be really helpful as an example, but certainly not the only thing. Podcasts are also very good at providing perspective. And so do whatever you can do to get that perspective from outside where you are. Because one of the differences between flight and ground is ground serves a community, a particular community, and flight usually serves multiple communities. So being aware of how other people do things is important. And then the last thing that I would say in preparation for flight is get to know the program where you are. A lot of people think that their flight program where they are is the best. And you can compare that to like your dog, like my dog is the best dog, and then your dog is also the best dog. So your flight program is the best flight program, and my flight program is also the best flight program. And so get to know those people. Most programs have a ride-along option, and so you can call and request or email or reach out to them somehow and request to do a ride-along. Get to know them, get to know the culture, get to know their priorities. Safety should be a really big one, and just see how the crews interact. And then you can decide, is this a program where I see myself, if this is a goal that I have? And if the answer is yes, then you know what to do, and you've made some connections, and hopefully you can kind of stay in the professional connection with those people. And if you do that ride along and you say, I didn't really like the way that worked, I didn't like their perspective on maintenance, I didn't like their perspective on education, then you can go look at another program. But that would be like my 3 general steps would be: number 1, be good at your job, be the best at your job. Number 2, get an outside perspective. And then number 3, make connections with your flight program and then pursue those professional relationships. And then that will help you get towards that goal.
Okay. So what about additional education? I mean, we don't necessarily have a degree in flight medicine for the profession, but what else is out there? And this could be quite different from what was out there 15 years ago, 20 years ago, when some of these programs were spinning up. So,
yeah, there are a handful of critical care paramedic options. There are also specifically two kind of advanced practice certifications that people look for. There's the FPC, which is the Flight Paramedic Certified or certification, and there's the CCPC, the Critical Care Paramedic Certification. Those are put on by the International Board of Specialty Certification, and most flight programs require those advanced certifications. So a lot of the education that's out there focuses on preparing people to take and pass those tests. And that is good. I do that. Like I travel around and I teach, and I love doing that. Part of that is teaching the content, and part of it is preparing for the test. So it's interesting because that is the goal. Like that's how we measure that knowledge, is through those tests. However, anybody can take those tests. So you can finish paramedic school, decide that you want to take your FPC, take your FPC the next week, and potentially pass it and hold your flight paramedic certification without ever having any education specific to that. So pursuing the educational opportunities is, as you mentioned, sort of wide open. There's a whole lot of variety. There's online programs, there's in-person programs. Many colleges offer some sort of critical care paramedic education, and I would require looking into what you have available locally. And if you don't have any options locally, then that's where the conferences come back up. Conferences have their strengths and they have their weaknesses, but one of their strengths for sure is providing education that you might not have at your disposal in your immediate vicinity. So there are a lot of companies that provide online classes, and they're wonderful. There are some colleges that provide in-person classes, and they're wonderful. And then there are conferences that provide some education as well. And I would say figure out what works for you, and then pursue that. Having been in flight and seen people come and go over the years, it is often most beneficial if you can find some in-person education, specifically with lab stuff. I know that as a paramedic, things that were very foreign to me at the time were IV pumps. And I know IV pumps are on a lot of ambulances now, but that was new to me. Intra-aortic balloon pumps were new. LVADs and Impellas are different. Video laryngoscopy may or may not be different. Ultrasound may or may not be there on the ground. So find out one of those educational opportunities. And if you can, find one that has an in-person component or lab component too. And I think that's really, really helpful.
So with your varied experience, historically, what have you seen as far as the changes in flight, and kind of what do you see for the future of flight medicine? Because I mean, we see in the news quite a bit, and everybody's talking about helicopters. And unfortunately, sometimes it hits the news when something bad happens, or the surprise bill of an air ambulance versus the surprise bill of a ground ambulance is kind of what hits the news. But what have you seen, changes in the industry, and what do you see as, potential future for the industry?
Yeah, I think that the answer to that is beyond my reach, but I'll give some ideas. If we go back before I got into flight, back into like the 1980s, as my kids say, the 1900s, flight was essentially a primarily clinical concern. So hospitals would buy these helicopters, train the crews, and then those crews would be the highest performing, most highly educated people. And the helicopter would take these crews out, pick up an extremely ill or injured patient, and bring them back. And it was like the pinnacle of medical performance, certainly in the outside the hospital walls. Over time, various forces at play found out that they could make money off of this. And so then it shifted a little bit from a primarily clinical concern to a financial issue. And I think with that, we had a whole lot more helicopters because there was a whole lot more money to be made. We switched from primarily hospital-based crews to primarily community-based crews. And I worked at a community base for a long time, and I loved it. And I think there's a lot of value there. So I'm not saying anything negative about those. But over time, the focus seems to have shifted. Or to tackle a different analogy, the pendulum swung from the clinical side to the money side. And I think that things will start to swing back because of the repercussions of those decisions. So when patients get abnormally and unreasonable bills for services that lasted less than an hour, things have to change. And I think it's possible that we start to see fewer helicopter bases, medical helicopter bases, and we start to swing that pendulum back towards the clinical side. And I think everybody would be on board with that. I know that all the crews on the helicopter would support that. And I think crews on the ground who utilize helicopters would appreciate that too, because what you want is somebody who is of the highest possible quality coming to provide the assistance that you needed when you called for that helicopter. So I certainly don't know what the future holds, but that's what I would do. I would decrease the number of helicopters and increase the quality that we are able to provide.
Well, one of the things, and this has always been kind of an issue. I don't know an issue, but just kind of the result of money, population growth, things like that, where you would see helicopters in cities, and you're like, we don't use helicopters in cities. When your closest hospital is no more than 5 minutes or 10 minutes away, that time part of the equation, doesn't factor in as much. But with rural medicine and the community access hospitals kind of going away, having problems with that, what kind of role do you think air ambulances would have in servicing the rural parts of America?
Yeah, I think that's the perfect role that helicopters can fill. The idea that helicopters essentially do two things. They go fast and they provide a high level of care. And obviously that's not the helicopter itself, but the crew within the helicopter. So the helicopter is fast, and the crew that works on the helicopter should provide a high level of care. As you mentioned, in a city, that speed may be irrelevant. If you can beat the helicopter to the hospital, then that is no longer an important piece of the puzzle. And then the other part is the level of care. So if a crew is able to provide the same level of care that the helicopter crew is, then that becomes a piece of the puzzle that is eliminated. So in a rural facility or a rural area of the country, I think that's the perfect place for helicopters. If there is limited access to a handful of time-sensitive issues, think strokes, think heart attacks, think trauma. Those are the three big ones. There are others, but those are the three big ones. Then the best way to get someone from out in middle America or somewhere where they're quite some distance away from a tertiary care facility that can provide interventional cardiology or interventional neurology or level 1 trauma services, then that helicopter can do those things, can bring the high level of care out, can continue that level of care and transport, and can do it quickly. And I think that's what it's all about.
So as we start to wrap up, any bits of wisdom for anybody that's interested in thinking about going to flight?
Okay, yeah, I'm going to repeat the same three things that I said before. I think that's the best advice generally that anybody can have entering flight. One is do your job well. So be excellent at what you do. Two is seek education beyond what you have available immediately to you. And then three is reach out to those flight programs and make those connections. Get that experience, see if you like it or not. Maybe ride at a couple of different programs and see what you like. But be excellent at what you do. Seek that additional education. And make some sort of connection with flight programs in your area or outside your area, wherever you've wanted to be. Reach out to those people and try to make a personal connection with them.
Great. Well, Dr. vonRosenberg, thank you very much for joining me today again, and we look forward to hearing from you in the future.
Wonderful. Thank you for having me.